For more anatomy-related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
Hello everyone, in this video we will discuss about pleura. So what is pleura? Pleura, it is a double layered membrane which envelops the lungs. Similar to pericardium in heart. We have already discussed about pericardium. If you have learned about pericardium, it will be easier for you to understand what pleura is. So pleura, it is a double layered membrane which envelops the lungs. So it has got an inner visceral layer which is in close contact with the lungs and also an outer parietal layer. So in between the inner visceral layer and the outer parietal layer is the pleural cavity which is filled by the pleural fluid. So this is the lungs and this is the inner visceral layer and this is the parietal layer and this is a pleural cavity in between the visceral and parietal layer and this is filled by the pleural fluid. So the pleural fluid which reduces the friction between the two layers and it also helps in breathing. It helps in the easy movement of the lungs during the breathing. So the right and left lung both have separate pleural cavity so that infection in one lung do not affect the other. And the pleura, it envelops the lungs except at the hilum. So hilum, it is the place where the blood vessels, veins, bronchus, etc. opens into the lungs. So except at the hilum, the pleura covers the whole lungs. At the hilum, the visceral as well as the parietal pleura, it is continuous. If you want to know how it is continuous, we have to learn about the fetal lungs. So this is the fetal lungs and this is the pleura. Pleura of the right lung, pleura of the left lung. And as the fetus grows, the lungs also starts growing and it gets bigger and it pushes itself into the pleura. That is, it invaginates into the pleura. So the pleura, it envelops the both lungs. So the inner pleura, that is the visceral pleura, it gets adherent to the outer surface of the lungs and the parietal pleura, it is seen above. And the visceral and the parietal pleura, it is continuous, that is, it is continuous at the hilum. So now we will discuss about the boundaries of the pleura. So superiorly, there is a root of the neck. Inferiorly, there is the thoracic surface of the diaphragm. So inferiorly, the boundaries of the both pleura is the thoracic surface of the diaphragm. That is, here you can see the diaphragm. And medially, this is the mediastinal space. That is the space between the two lungs. So medially, there is the mediastinal space. And anterior and lateral and also posterior wall, you can see the costal cartilage, intercostal muscles, etc. So these are the boundaries of the pleura. So superiorly, there is a root of the neck. Inferiorly, there is a thoracic surface of the diaphragm. And medially, there is the mediastinum, and the anterior, lateral and also posteriorly, there is the costal cartilages, ribs, intercostal muscles, etc. So first we will discuss about the parietal pleura, that is the outer pleura which is more thicker. So it has got four parts, that is the upper part, it is called as the cervical part. It is the dome shaped part of the pleura which covers the apex of the lungs. And next is the diaphragmatic part which covers the outer surface of the diaphragm. Next is the mediastinal part which covers the lateral aspect. So this is the mediastinal space and which covers the lateral aspect of the mediastinum, and also the costal part. The costal pleura, it occupies the maximum space. That is, it covers the ribs, the costal cartilages, sternum, intercostal muscles, etc. That is, it covers the inner aspect of the thoracic wall. So next is the visceral pleura. which is in close contact with the lungs. It is a delicate layer, that is, it is a serous layer which is more delicate than the parietal pleura, and it covers the whole lungs except at the hilum, and the visceral pleura is continuous with the parietal pleura at the hilum. And now we will discuss about the nerve supply. So the visceral pleura, it is innervated by the visceral and efferent nerves by the pulmonary plexus. So visceral pleura, it is innervated by the visceral efferent nerves through the pulmonary plexus, and it do not feel pain, but it is sensitive to stretch sensations. So there are spaces in the thoracic cavity where the lungs do not invaginate, that is, there are spaces within the pleura which the lungs do not completely invaginate, and they are called as the recesses. So these are one of the two recesses. So these are spaces in which the two layers of the parietal pleura which opposes each other, and these two recesses, they are called as the costodiaphragmatic recesses, and this gives an extra space for the lungs to invaginate during the forced inspiration. So this is the costodiaphragmatic recesses. So lungs, which is covered by a double layered pleura, and it has got an inner visceral layer and an outer parietal layer, and in between is the pleural cavity which is filled by the pleural fluid. And the parietal pleura, it has got four parts, that is the cervical part, the mediastinal part, the diaphragmatic part, and also the costal part. And the visceral pleura, it is in close contact with the lungs, and it is adherent to the lung. It is much thinner than the parietal pleura. So this is the end of today's class.